Okay, let me see if it's working now. Yay! Okay. Well, I'm gonna just get started because I already wasted like what? A good 20 minutes. So I'll just get started. Okay. Thanks for coming on, guys. Abraham. I'm sorry if I'm coming on. All right, so guys, tonight's video or live stream rather. So this is a topic I wanted to talk about on my channel for a while, and this the pros and the cons or the good and the bad of being a young nurse. Um and I'm actually pulling up my script. I had a script so I won't like forget anything. So I'm gonna just jump right into it. Oh wait, I can't have Starbucks inside my live stream. I don't want to get a copyright. So okay, the pros and cons of being a young nurse. As we know, being a nurse is very rewarding, especially at a young age, but it can also come with challenges. So a young nurse would be probably classified as like a zillennial or Gen Z. And the reason I say zillennial is because, zillennials are more toward the younger cusp of millennial, late 90s. So yeah. I feel like as young nurses, we tend to have a little bit of what I would call a unique experience in healthcare. And the does outweigh the bad. This is not like a rant video or like me complaining, but I felt like the topic would be resourceful for young nurses that are coming into the profession. Uh, so I'm gonna start with the cons first because I want to end with the pros so we can like end on a good note. All right. So, and I'm gonna be honest, a lot of these things I did make well not make up, but a lot of these points I did get from Chat GBT. But with each point I do want to chime in and talk about my own personal experience. So oh, thanks, Jasmine. I'm gonna try to switch in between like the live and then my because I don't want to miss anything. So let's see. And I also don't want this in the way. Let me see. All right. So our first con to being a young nurse would be lack of experience. So it says while young nurses are often eager to learn, they may struggle with complex medical situations or high pressure scenarios due to lack of experience. This can lead to feelings of insecurity and self doubt. They may have trouble, or young nurses may have trouble making quick or informed decisions in critical situations. Um, Especially situations that would need a nurse, whereas that nurse has years of experience in the practice. Another point is that a lack of experience can lead to difficulty handling complex situations, which can lead to that young nurse becoming frustrated. So I want to chime in and give my own personal experience to this. So I think there may be some truth to this. As a When I was a new nurse, I did find myself feeling stressed a lot, especially like during moments of chaos. But I don't think I've ever struggled with self doubt because I was one of those nurses that didn't mind asking for help when I wasn't sure. And I still ask for help when I'm not sure. And I think that's something that every new grad nurse or young nurse should get comfortable with, asking for help. Um, and this is a huge one: stereotyping and ageism. So, younger nurses might face challenges with older colleagues or patients who perceive them as inexperienced or less capable. This can result in a lack of respect or being overlooked for leadership roles. As well as struggling to earn trust, it can be tough for young nurses to prove themselves and gain the trust of more experienced staff, especially environments where seniority is highly valued. So, your colleagues, when you're a young nurse, may think that you don't know what you're doing. So I feel like as a young nurse, we often have to, I'm not even going to say prove ourselves. I know some young nurses do it, but I'm not going to prove myself because I know that I took the state boards and I went to school and I deserve to be on the unit like everybody else. I feel like young nurses do often experience that a lot of their colleagues or coworkers may feel as though because they're young, they may not know what they're doing. And then you may get that from patients as well. You may get patients who don't feel comfortable with having a young nurse because they feel like they may not know what they're doing. I've had a patient who actually asked to be taken care of by an older nurse. And that older nurse actually ended up making a mistake. So just because, and I'm not saying, it's a bad thing. All nurses make mistakes. But just because somebody is older or younger, that doesn't make them less. What else? Managing stress and burnout. Nursing is emotionally and physically demanding, and young are prone to burnout if they don't establish good self-care routines early. New nurses may find it challenging workloads, patient care, and administrative duties without proper support or guidance. Due to high energy, young nurses might initially push themselves too hard, risking burnout if they don't set boundaries early on. It so Personal experience. There is nothing wrong with setting healthy boundaries, no matter if you're a young nurse or old nurse, experienced. I've worked with so many nurses who set healthy boundaries and they've told their nurse manager or the charge nurse, I'm not taking a certain amount of patients because I feel like it won't be safe. And also, speaking of burnout, so I worked so much overtime when I was a new nurse. The bonuses, they look good. In my first year of nurse as a nurse, I was working like 72 hours a week. And I just became a nurse. This was like in the middle of COVID. So yeah, I think I burnt myself out early on in my career. I barely pick up overtime now. The most I probably pick up is like three extra shifts a month, but I don't have it in me anymore. But I do feel like when you are a young nurse, which I'll save that for one of the pros. But that can be a good thing and a bad thing. Like when you're young, you feel like you have the energy to work overtime, but that I feel like that can in a way make you a little bit more burnt out faster than um your colleagues constantly picking up overtime. But I mean, I don't knock it. Get it in while you can. I did. And now I'm burnt out and I don't work overtime at all. But um that can be a pro and a con. And I'll talk to you guys about that being a pro as well. Um I'm sorry, give me 1 second. Um So, okay, hierarchies. Young nurses might encounter difficulties in communicating with or navigating the expectations of colleagues, such as differences in work style, communication preferences, and values can cause friction. So, emphasis on this. Different generations have their own way of doing things and their own way of communicating. So, if you are a young nurse and you are working with a boomer, the way that they communicate may upset you, and then the way that you communicate may upset them. Um, so I think just having those generational differences can cause in the workplace. But if you just like understand that boomers are different than millennials or Gen Z, then I think you'll be absolutely fine. But collaboration. So as young nurses gain more experience, they need to learn how to assert themselves more. And I actually have quite a lot to say about that, especially when it comes to speaking up about patient care concerns or advocating for themselves in a team environment. Now, this is true. Um, this is one of the main reasons I actually wanted to have this conversation channel. I feel like when you are a young nurse, people, and when I say people, I mean coworkers, patients, family members, even may not take you seriously. Especially if your colleagues are older nurses, because I think in a way they still kind of view you as a child. And I feel like when you're a young nurse, you're often put in situations where you have to defend yourself or constantly advocate for yourself more so than an older nurse. Um, so I've experienced this. I've been in plenty of situations where an older nurse was very disrespectful or rude to me, and I had to put them in their place. Because one thing I've noticed, if you don't stop disrespect, especially in nursing, nursing is a very rewarding career, but you have to keep in mind that you're working with a lot of different personalities. Um, oh yeah, yeah, boomers can be very hard to work with. But yeah, I feel like a lot of times when we do advocate for ourselves or defend ourselves, in situations of disrespect, sometimes we may feel a little bit bad about, but never do that. Don't think you're overreacting. Because again, if you don't stop disrespect in their tracks in a profession where you're working with so many different personalities, it can turn into harassment. And in terms of patient care, oh sorry, my uncle was calling me. Um, but in terms of patient care, also, I feel like if you are a young nurse, a lot of doctors may not trust your judgment because they feel like being young, uh, they feel like by you being a young nurse that coincides with inexperience. And I still deal with that a lot now. Like doctors will think that I'm overreacting or I'm being dramatic about a patient's condition. And in situations like that, when that happens, and I think I've said this on my last live, in situations like that, when you feel like the doctor is not taking your concerns seriously about a patient, then just chart it. Like, if again, I think I said it on my last live, one time a doctor told me, "You're getting on my nerves. Stop calling me," when I kept calling them about a patient's condition. I charted it and I charted exactly what they said because guess what? My butt was covered. Something happened to that patient, my butt was covered. And also, in terms of patient care, one thing I've noticed in one of the nurse managers taught me this: it's better to overreact than underreact. If you feel like your patient is crashing and it turns out you were just overreacting, at least at the end of the day, you know you did everything to make sure that patient was safe. So yeah, Again, just, if you're a young nurse, always make sure you advocate for yourself, advocate for your patient. You may have to do it a little bit more than often and do it more than your older coworkers or elder coworkers, but it's worth it. And don't feel bad about it. If someone's disrespecting you or talking, who tried to talk to me like their child. And I think also we have to keep in mind that there are cultural differences as well, because in some cultures, an older nurse or older coworker, their culture may look at a young nurse as if, or a young person in general, as if they're their child, like they're supposed to take on this role as like a parent or an authoritative figure. But it, again, when you start to feel you are being disrespected or being treated unfairly in a workplace just because of your age, again, stand up for yourself, advocate for yourself. um and honestly, you can always find another job, especially in nursing. And building confidence. So, dealing with imposter syndrome. A lot of young nurses may often feel like they're not good enough, have that fear of making mistakes, even though mistakes are a part of learning. Building confidence takes time and experience. I have had fear of making mistakes, but fearing mistakes, that's not going to prevent mistakes. Mistakes make you feel like you are a bad nurse, whether you're new or experienced, young or old. Um, Mistakes is like in nursing or any career you're in, you never stop learning. So no matter what your age is, or no matter if you're a new grad, if you're an experienced nurse, never feel bad about making a mistake. Learn, you can never stop learning. And I will say, every mistake that I've made in my nursing career, I feel like I've learned from them, and all of those experiences made me a better nurse. Now, speaking of mistakes, if you know that you've always practiced as a safe nurse, and then all of a sudden you move to a new unit or you get a new job, and then you find yourself making consistent mistakes, and you know that's not how you typically practice. Your workplace may be toxic. Your workplace may be toxic, but I'm going to save that for a different video. Um, Finding a voice, learning to express opinions. Um, some young nurses may feel like older nurses or other nurses, other colleagues may be intimidating, and it's hard for them to find a voice to speak up for themselves. What else? Maintaining a healthy work balance. Let me just read what it says. It says demanding hours and emotional toll of nursing can make it hard for young nurses to trying to advance their career or manage family and social commitments. So I worked a lot of overtime, especially like because, like I said, I became a nurse during, like, it was still the pandemic. Um, I think for the most part, I did try to keep a healthy life balance. So I think I told you guys I worked like like when I was a new grad, I worked like 70 hours a week. I would take a few days off after that. Like, I would hit the gym, get back grounded. I wouldn't let my body get too overworked. But finding that work life balance can be hard when you're a new nurse, but you'll eventually find your flow. But that's important too. Handling shift work. So adjusting to night shift, long hours, irregular schedules can be challenging to you both physically and socially, especially if younger nurses lack coping skills to handle such a lifestyle. So my first 2 years as a nurse, I was on a rotating schedule. So I would do some nights and some days, which that can be really hard on the body. And this is why it's important to have balance, because too much physical and mental demand can begin to take a toll on you. And let's be honest, I mean, nursing is a lot on your mental. It can cause a lot of mental exertion. Constantly having to think for 12 or even 16 hours straight can be a lot on the mind. Let me just I'm just chiming into the chat to make sure I didn't miss anything. Because again, I'm looking at a Google Doc so I can make sure I don't forget anything. Your hair looks nice and shiny. Okay, so where was I? All right, so financial challenges. So many young nurses graduate with a significant amount of student loans. Their job salary might not always match the financial pressures they face early in their careers. And a low starting pay. Entry level to the high demands of the job, which can lead to financial strain for younger nurses to. So this is true. So your starting pay can actually vary depending on where you practice, as well as your specialty. And you also have to consider a starting pay for a nurse with no children may differently um, than responsibilities, bills, etc., etc. So you also have to take into consideration like what's going on in the person's personal life. And again, I'll say that. But limited guidance. So, in some settings, younger nurses may struggle to find mentors who can help guide them through situations and provide constructive feedback. Always welcome constructive, but never welcome disrespectful feedback. Ever. Ever, ever. Always, again, always stick up for yourself. Always advocate for yourself. Do not tolerate disrespect. I don't care how many letters are behind that person's name. I don't care if they're DON, ADON, ABC, LMNOP. Tolerate disrespect. But always welcome constructive criticism. It's not what you say, it's how you say it. So, as I stated before, guys, I became a nurse again during the pandemic. So, my orientation period was very tough. We were short staffed, so it was very hard to find a nurse that was willing to train me and orientate me. And then the unit I started out on, it was already like short, it was short staff. It was like a dumpster fire. Um, and all of the nurses on that unit, they were already burnt out themselves, so they really didn't have like the mental or physical capacity to even train a new nurse. They did eventually find a new nurse to they did eventually find a nurse to train me. Shout out to my girl Ivana, but her schedule was slightly different than mine, so we kind of orientated together when we could, but you know when you're I look at it like this. When you see a nurse on the unit, even if she's not training you, but if you see a nurse on the unit and she has on baggy scrubs and dance goals and she has a sharp bob cut, you know you're going to be in good hands. But yeah, when I first started my nursing career, I did not get the orientation period that I was supposed to get, but there was a nurse that was willing to train me when she could. Um, so yeah, I can agree with this. I definitely had limited guidance. Um, but I still learned a lot. I still had to grow my own wings and you know, I eventually made it through. But yeah, I was a little like bothered by it at first, like, oh my gosh, nobody wants to train me. But once I got like a couple of months of experience under my nursing belt, I understood like get it. Um yeah, I wouldn't do that, but I understand. Feeling isolated. Without mental isolated, especially if they are new to a specific unit or hospital. I never felt isolated. I would rather be left alone. But I mean, you'll eventually find some coworkers that you love and become friends with outside of work. But if I didn't find them, I'd be fine without. Um, some healthcare environments might have rigid hierarchies that make it harder for young nurses to advance quickly. Finding opportunities to further education, certification, and leadership roles may be slow and frustrating early on. As younger professionals, young nurses may feel the need to constantly prove their competence and commitment, which can be mentally and emotionally exhausting. Though I have, like I said earlier, experienced coworkers or even patients feeling like I may not be competent just because I'm young. Listen, I'm not going to try to prove myself. I know that I went through schooling. I know that I took the NCLEX, and you guys should feel the same way. If you are a young nurse and you are going into the profession of nursing, understand that you deserve to be there. You did not become a nurse for the aesthetic. You were in fight or flight mode, constantly survival mode for a good 4 years to become a nurse. And after that, you set and you study for the NCLEX. So just don't feel the need to prove yourself. Your work will speak for itself. You don't have to constantly feel like, oh my gosh, I gotta prove myself to show my coworkers and all of these patients and all of these doctors and specialists I'm a great nurse, even though I'm young. No, your work will speak for itself. Um, and again, I am all for people asking questions when they are not sure. But yeah, just keep in mind there's still so much good in choosing nursing as a career. And though I may have, stated a couple of challenges, I feel like all of these challenges should embrace. Um, because I mean they're tough, but you overcome them, and eventually those challenges do make you and shape you into a great nurse. And yeah, they definitely, because I wrote some stuff down so I wouldn't forget. But they definitely make you resilient. These challenges make you stronger. They've helped me to grow in 21, like actually like working as a new grad nurse since 2021. So yeah, they make you resilient. They make you smarter. They help you to grow in experience. Um, and through all of these, always prioritize self care. Um, 40-minute jogs, spa days, stay away from the cafeteria food at your job because it will sneak up on you. Those unhealthy carry out foods, stay away from them. If all your coworkers are saying, oh, we're ordering out, tell them no. You don't got to explain to them what you brought, just tell them no. But yeah, definitely take care of yourself. And we are done with the cons. So we're going to go on to the pros so we can end on a good note. Let me just check in and make sure. No questions before we move on to the pros. Okay, no questions. I guess we're moving on. So, what are the benefits of becoming a nurse at a young age? Job security and high demand. So, nursing is a recession proof career with strong job stability. The demand for healthcare professionals continues to grow. So, getting into the field early or young sets you up for long term employment opportunities. As I stated before, in nursing, even if you're not a nurse, even if you're a CNA, I feel like you will always have a job. There are so many different routes you can take in nursing. And you guys know what I love to say. You could go to Mars and they will have a job for nurse there. Financial stability and growth. So RNs can earn competitive salaries, often with benefits like health insurance, retirement plans, and tuition reimbursement. Nursing offers competitive salaries right from the start, allowing you to become financially independent sooner. And again, like we said earlier, of course, some specialties may not pay as much. Like if you're going into a med surge unit as a new grad, you may not get paid as much. But if you go into like the ICU, CVICU, NICU, pediatrics, I think peds make pretty good money, and OB nurses make really good money. So just depending on your specialty, you might get paid a little more than a nurse that may, be going into med surge. Also, nursing homes, skilled nursing facilities, they pay really good money for new grads. Uh, but yeah, yep, nursing offers competitive salaries, allowing you to become financially independent sooner. Many hospitals offer sign-on bonuses for new nurses, which I'll tell you guys why I'm laughing at that, which can help with student loan payments or savings. When you are a new grad and you first sign a sign-on bonus, please make sure you read the contract, because a lot of times these hospitals will tell you, if you sign on with us, we'll give you $10,000 after your first year of being employed with us. But say you leave after you get that $10,000, you may have signed away or agreed with them being able to sue you after you leave. So some hospitals will do that. You take the sign-on bonus, you sign the contract, but that fine print says if you leave after that 1 year, after getting the sign-on bonus, we can sue you. Also, you also might want to stay away from those sign-on bonuses that are a little too much. I'm talking like $25,000 sign-on bonuses. There's something not right about that unit. You might want to run. Because that happened to me. I took on like a job. It was actually my first because remember I told you I got my first job as a new grad working at a skilled nursing facility. Then I went on to work get a job as a step down, working on a step down unit, because I didn't really care for the skilled nursing facility and nursing home ratio is just crazy. Like 1 to 40 patients, one nurse to 30 patients. That was insane to me. But I got a job on a step down unit. The nursing was still trash, but it was a little bit more manageable. But I did sign like a $20,000 sign on bonus, and I didn't last 6 months. I only lasted about 5 months at that job, and I understood why the sign on bonus was so high. What else? So, staying young allows you to build financial security early, and save for major life goals. Many nurses often earn additional income through overtime, shift differentials, and per diem work. This is true. Starting young gives you time to explore different nursing specialties, gain experience, and advance your education. So you can pursue higher degrees such as like nurse, CRNA, and reach leadership positions early in your career. You can climb the career ladder. You can take time, to find your passion. That's another good thing I loved loved about starting off young, as a little bit more time to find like my passion in the career. Like for example, if you would have even told me in nursing school that I was going to be working in pediatrics and loved it, I probably would have looked at you like you were crazy. So, yeah. And also, speaking of career advancement, a lot of jobs will actually pay for you to go back to school. So that'll allow you to save money so you don't have to pay out of pocket. What else? We're almost done, guys. We have like 1 page left. So yeah. Nursing offers flexible schedules, including full-time, part-time, per diem work from various settings, hospitals, clinics, schools, travel nursing, even remote jobs. And as I said in my last live, one of the many things I love about nursing is that there are so many different the possibilities are literally endless. I know there was one young lady on here saying last week or the week before last, saying that she wanted to study psychology. She said she wasn't sure if she wanted to do psychology or nursing, and I told her she can do both. You can become a psychiatric nurse or a mental health nurse. Even if you love criminal justice, and that was something that always interested you, you could become a forensics nurse. Um, so yeah, if you feel like you're getting burnt out or you want to look for something new, you can look for a job that's not bedside. I mean, you could do so much in nursing. It's crazy. Um, Speaking of travel nursing, so there's opportunities for travel and adventure. If you love to travel, you could become a travel nurse while you're young. This can be exciting, an exciting way to see new places while earning great income. Travel nurses often receive higher pay, housing stipends, and other perks. So usually if you become a travel nurse, the agency that you're working for would give you money to pay like utility bills, water bills, and of course it would give you like, money for groceries and things like that. The travel nurses are not making what they used to, like during the pandemic, but they're still making pretty good money. Still, I mean, think about it. You're making $4,000 every 2 weeks. It's okay because you as a travel nurse, you'd be making like 4,000 every week versus every 2 weeks. Um, and it's not listed here, but similar to travel nursing, you could also do agency nursing. Now, agency nursing is similar to travel nursing in many ways, but there are differences. So, working for an agency, you would travel around locally to different places like hospitals, maybe schools, nursing homes, skilled nursing facilities, rehab centers. Um, and your shifts, again, they're not out of town, they're local. So if you live in the state of Delaware, you would just pick up per diem um, at facilities or healthcare organizations in Delaware. So nurses usually work uh, through a contract. So they'll sign a contract agreeing that they'll be at a designated place working for like 6 to 8 weeks. With agency nursing, you pick up a shift, and if you don't like it, you don't have to go back. Um, but yeah, what I love about agency nursing is uh so you don't have to stay at a set place for a certain amount of weeks. Um, and all you have like a couple of days off at your full-time job and you don't want to pick up overtime, you could work like you could pick up like a shift up overtime at your job. And also another good thing about agency, you could either work 8-hour shifts and you get paid right away. So I know nurses that actually do work full-time agency nurses, and they make money, so much money. Um, because again, agency would pay you more than what you would get paid than if you were staff at that hospital or at that facility. Um, and also the agency also gives out bonuses if the place that you're working at is in desperate need of help, and really everywhere is in desperate need of help for nurses. So you're always getting paid a lot of money doing agency. So yeah, that's a good agency is a good way to make money full time or per diem. Strong personal fulfillment is another pro of being a young nurse. Nursing is a career that allows you to make real differences in real lives every day. So starting young means you get to experience personal and professional fulfillment throughout your career. So nursing certainly fulfills you. It's a very rewarding job, and many people don't mention that it also rough morning and you end up having a patient that's your age connected to like IVs, a trach, G tube, and instantly like your mood shifts and it makes you a little bit more appreciative. And it also makes you appreciate that you're helping people that can't help themselves. So, nursing is a very rewarding career, and start definitely keeps you grounded. It keeps you humble and it keeps you emotionally fulfilled. So, this is last pro. Not unless you guys wanted to add anything. But let me see. just switching back to the live stream just to make sure I didn't like miss any questions. Okay, no questions. That's fine. You guys are so boring tonight. No questions. Okay. Well, it's not a Q&A, so I can't complain. But thanks for coming on. I really appreciate everybody who's on. So physical and mental resilience. Nursing can be physically and emotionally demanding, but being young gives you the energy and adaptability to handle long shifts, fast-paced environments, and new challenges more easily. Young nurses all have more stamina and energy, which can be helpful in physically demanding environments such as long shifts and fast paced hospital settings. So again, when I was a new nurse, I did work those long shifts. Sometimes I would work like 12 to 16 hours a day, especially during COVID. You came in at 7 a.m., you were supposed to get off at like 7 p.m., but your relief never showed up. So you were in there till like 1 in the morning until they could find a nurse to come in and cover you. COVID was crazy. But nonetheless, yeah, I definitely got in like a lot of overtime when I became a new nurse. And like I said, it's nothing wrong with it as long like I'm all for working overtime. Again, I was working like 70 hours a week. Just make sure you have that balance. Like, give your body rest when it's asking for it, because if not, your body will take it. But yeah, it's definitely that's actually it. It's definitely a lot of pros and cons to being a young nurse. Like, I've had my set of challenges, but it definitely gets better. It gets easier. You pretty much just learn like how to adapt to different generations. I know Jasmine said boomers are very hard to work with, and that is true. Like, boomers believe in you coming in, you accepting whatever patient ratio you get, and if you leave or you don't accept the assignment, then that's considered abandonment. It's not considered abandonment if you don't accept the assignment. Like, but they're different. They will, like, I've worked with boomers who will literally be happy about having a dangerous, like, oh, back in my day we had to have about like 10 patients, 10 ICU patients. Like, that's dangerous, that's terrible. But they believe in, also, our generation, we're like, if we tell you we're going on vacation and you don't approve it, we're going anyway. They're not that, like, it's just working with boomers. It's funny. Like, it's definitely a generational shift between by the time you get from the boomers to us, because like the way they just believe in like hard work. I feel like you should work smart, not hard, but boomers are all for working hard. Again, they feel like whatever nurse to patient ratio you get, you should take because you took an oath. Like, no, I took an oath to provide patient care. I did not take an oath to work in dangerous conditions. But nonetheless, we love our boomers. They're very experienced, very resourceful. But yeah. Nobody have any questions? No questions, none. Well, let me see. If nobody has any questions, I'm going to just end it. Thank you guys for coming on. And I will see you guys next time. Thanks for coming on, Jasmine and everybody else.